We have some fantastic speakers today that I'm very excited to introduce. But before we get to that point, I have just some general HIMSS Arizona members or soon-to-be members for joining us here today. We're really excited to be able to share this important topic with you and engage with you in some dialogue. We have some fantastic speakers today that I'm very excited to introduce. But before we get to that point, I have just some general HIMSS kind of housekeeping and reminders to share here this day. So first of all, we couldn't put on this programming without our incredible sponsors. And as you know, it truly takes a village, and it's the same with every professional organization I've been a part of. We couldn't put on these programs, hold our events, or fund our activities without the incredible support of these sponsorships that we have in place. So thank you, Pivot Point Consulting, CDW, NetApp, Health Current and Contexture, AP Professionals, Nuance, Nutanix, Sentinel-1, and of course, HIMSS Global for supporting us today and helping us put on our programs. And for many of you who are here representing those companies, thank you again for doing that. Just to tell you a little bit about HIMSS, if this is your first time joining one of our events, the Health Information Management and Systems Society was founded in 1961, and originally it was the Hospital Management Systems Society. And as we know, healthcare has decentralized, so it's no longer just about hospitals, but more in general health information systems. We are a nonprofit, which is why we lean on sponsorships. All of us who serve on the board and on the committees are volunteers, so we have day jobs. And we're doing this on top of those responsibilities that we have in order to support our community of professionals. We are all volunteers that work here and help bring together this kind of programming. And the goal here is really to drive continuous improvement of management systems in healthcare and organize programs of research, education, and professional practice. And one of the things I love most about HIMSS is the ability to hear about all the exciting technology that healthcare systems might be adopting, researching, implementing, some of the great startups out in the world who are doing incredible things, and we're going to hear from a few of them today. And so thank you all for joining us and being part of this discussion today. We do have a member survey that we're trying to fulfill right now. And so if you have a moment, we would really appreciate getting your feedback. Every year, we like to conduct a survey from our members here in the Arizona chapter just to understand what topics you are hoping that we cover more of, what maybe some content or speaker recommendations that you might have to make our programming better. These are all things that you can help us with. And so if you give us your feedback, hopefully you can scan this QR code and let us know. I believe we could also send this, I'll flash this up again at the end of the webinar. So if anybody missed it at the beginning, we can get back to it afterward. So that's a little bit of housekeeping on our part. And then finally, just a reminder of our vision and mission is to realize the full health and potential of every human everywhere. And I think that's probably why a lot of us are working in healthcare in one way or another. You know, we're constantly being reminded of the importance of improving systems so that more people have access to care and can live healthy lives. Our mission is to reform the global health ecosystem through the power of information and technology. And just to let you know about some upcoming events, we're just kicking off the year with this webinar, which is our first event of 2023. But don't fret, we have a lot of great stuff lined up for the year, starting with our next webinar on February 16, which will be on virtual medicine best practices. Also, the same time at noon, that we have found that this is a good time. Everybody can kind of maybe use their lunch break to listen into this content. So join us on February 16th if you haven't already registered. We have some excellent speakers lined up for that program as well. On March 16th, we'll be covering technology to inform clinical best practices, and then also a webinar. So virtual, you can join from your desk. And then we will have an in-person event. We're looking at for Thursday, March 23rd, our spring celebration at the Desert Botanical Gardens. And I know that everybody always looks forward to these in-person events where we can actually get together and see each other in person and catch up on our lives, our families, our jobs, how things are going. So we hope you can join us on March 23rd. And then for everybody who's traveling to Chicago for HIMSS Global Conference, that's always a highlight. We're very appreciative of Juno Health, which will be hosting a cocktail reception, and we'd love to all see you there if you are planning on being in Chicago for that event. Okay, I think I've covered enough housekeeping. Why don't we go ahead and introduce our speakers for today? I'm very excited to be able to introduce you to our two panelists today. And I do need to mention we had a third panelist lined up today, Dr. Kochmann, but he had a family emergency. And so unfortunately, he is not able to join us today as planned. But we have here Linda Buscemi, who is the Chief Clinical Officer of TapRoot Interventions, and Yukun Chen, the VP of Artificial Intelligence at Pieces, Inc. So why don't we go ahead, Linda, I'd love to let you introduce yourself a little bit in terms of, your journey, what you're doing at TapRoot Interventions, and just give us a little bit of background on yourself. We would really love that.
Sure. Yes. So I'm a psychologist by trade, about 25 years now, and had provider experience, worked for a health plan. So kind of got the whole ecosystem to really understand how to best serve people. And I created a company called TapRoot Interventions and Solutions, where we're actually created a technology. It's a caregiver tool that is AI-based, predictive analytics we're using to provide care partners, caregivers, the best solution to mitigate someone's reaction or behavior who are challenged with cognitive issues, whether it's dementia or someone who has schizophrenia or anything, any type of problems thinking. We're arming them with the way to actually approach someone to prevent that particular reaction or even decrease the intensity of it.
Fantastic. Thank you, Linda. It's so important. I feel like everybody I know right now is dealing with a loved one, a family member who's now kind of in memory care to some extent or needing memory care. So what you're doing truly affects many, many lives. Thank you. Yukun, can you introduce yourself, please, and tell us a little bit about what you're working on at Pieces?
Absolutely. Thank you. I'm a technologist to actualize AI and analytics solutions in healthcare. My training background is more from applied AI, machine learning, NLP, and biomedical informatics. And I joined Pieces like 7 years ago as one of the original members, and I was head of the AI to deliver basically generative AI solutions to help the care teams. Just a little bit about what we're working on most recently. So just 2 days ago, we deployed one of our solutions called Pieces Summary into Epic EMR for one of our clients, Houston Methodist Hospital. And basically, you can imagine we have users like case manager group, physician group, and potentially nurses. Hopefully, our tool here can help them to improve their clinical workflow, reduce costs, and etc. And so in addition, we also leverage NLP to surface social determinants of health and provide kind of population level analytics for the healthcare systems. Very happy to share more in this webinar.
Wonderful. Thank you, Yukun. Yes, and I will be digging in with some questions more specifically to get some examples. Linda, I'd love for you to share just very briefly with everybody here. Tell us a little bit about Ella and, what is Ella? What does Ella do? And what are some examples of how you're capturing data and utilizing it to develop better, more effective interventions for memory care patients?
Yeah, so Ella is our application, and we believe Ella elevates the caregiver. And so to date, what typically happens is that you will put a behavioral plan or some kind of care plan together, and the staff have to actually try to find that. So if someone's having a dementia-related symptom or reaction, behavioral expression, perhaps they're not allowing you to change their clothes. Right now, we have to try to figure out a way to be able to do that, and staff have to try to find that behavioral plan. Like, okay, what was it again? What was I supposed to do when this happens? Well, Ella is actually on an app. And so we actually are capturing not only the background of the individual, so what type of dementia they have, what type of medical conditions do they have. Vascular dementia is much different than Alzheimer's, actually. Alzheimer's, the first symptom is really memory. vascular dementia is more processing. And so we're not necessarily expecting our caregivers to know all the education behind all of these diseases. There's hundreds of types of cognitive impairments and what's causing that. And therefore, a psychologist or some kind of professional will actually help the caregivers try to figure out what's happening. And here are some approaches and interventions to try to prevent or reduce that. Ella actually looks at the background of the individual and provides the actual intervention that's personalized to that individual. And the caregiver actually looks at it and says, oh, okay, that's what I'm supposed to do. We ask them a simple question: did that intervention work, yes or no? That provides us more and more analytics to make our algorithms smarter and smarter to say, oh, let's see this profile right here. These are the diagnoses they have. Here's the background of the individual. This intervention is going to work, 82% of the time if we deploy it. And so right now our algorithms around 80% accurate on all of our reactions. So it's really a caregiver tool to not only help them do their job better, but also for us to collect analytics around that, so we can then get smarter and smarter and more granular around when you see someone who has a traumatic brain injury and their reaction, maybe they're easily frustrated or easily agitated. We now know we can look at the environment of the background because of the information that we're collecting and provide them that tailored intervention on what to do.
And, one thing that everybody is talking about, there's not a single healthcare system or organization that I've spoken to that hasn't cited staffing as a major problem that they're dealing with somewhere else. Like, I think every IT person here has heard, like, help us with our staffing problem in healthcare.
Yes.
How is Ella supporting that gap or making that situation that we're all dealing with more manageable?
So we're noticing two things. So first of all, we're getting greater caregiver engagement because they're now engaged in the process. We're actually providing them a tool. They feel more empowered in letting us know what's working for them and what's not. So we're actually seeing an increase in engagement. We're actually seeing an increase in documentation because it's handheld. They can voice text it. It also converts the information to their native language. So we're really trying to tailor the care. And so we're getting positive feedback from communities that have Ella and communities that don't. So that's number one. Number two would be, we learned this during the major part of COVID, where most of the caregivers, some communities had no actual FTE caregiver there. They were using agency. They call them agency, which is a temp agency. And we got really good feedback because these folks don't know. They're coming in to fill a gap. But they don't know these folks. And to go through, first of all, they don't have access to the EHR, but even if they did, they'd have to scroll through and try to understand all these people. And they're there for a short time to care for those individuals. With the Ella app, they can actually get on the app, see exactly what to do, what not to do, see the individual's picture, and just have it right in the palm of their hand. And the feedback was phenomenal. The temp agencies were just like, why can't every community have this? Because our caregivers go in, they don't know these people from Adam. And so it's really filling that gap of, if you do need a temp agency, they're more equipped and armed to care for the folks as if they were an FTE.
Right. Yeah. The age-old substitute teacher problem, right?
Exactly.
That's fantastic. And, with all of the staffing constraints that exist today in healthcare, everybody, even hiring traveling nurses, traveling staff, you're right. There's so much more, it seems like, turnover in terms of who is handling our patients, and giving them better tools to be successful is super important.
Yeah. And even when you get down to even the experts, I mean, there's not a lot of us that really truly understand some of these diseases. And this is a way for us to scale even greater and impact more communities and more caregivers' lives with one professional sitting and looking at all the analytics that we're actually able to see. It actually provides a better way of providing care to more masses with less experts that are available.
Right. And who hasn't been asked by their board or their C-suite to be more scalable in terms of what they want, right? Absolutely. Thank you, Linda. That's a great rundown on Ella. And I'll come back to you with some questions. I want to go over to Yukun here for a moment, put him on the spot, if that's okay. Yukun, when you and I spoke, you had given me some really great examples of how you're contributing to population care with your solution. Can you give us another one of those examples? You kind of touched on the Texas Methodist use case. And I think we'd all love to hear a little bit more here on that.
Absolutely. Thank you. So we basically focusing on some of the very kind of a long-term problems, such as length of stay and readmissions. There are definitely more, but here pieces AI surface, for example, discharge barriers, social determinant of health, and any clinical barriers that could basically assess the patients in the real time. And then we provide, for example, a summarization tool to summarize the patient conditions and actually integrate this into the Epic system, so that, for example, one of the advantages here is that, like, the care providers, so for example, nurses, even physicians, don't have to look at all the clinical notes, to really know what is going on. They could just look at, for example, a snippets, a couple of snippets about the patient, and really know what is going on. So one quick feedback is just from this couple of days where we have people on site to learn the feedback. One case manager is literally saying, because of the PC summary, we don't have to go to look at HMP notes, because we basically tell them why this patient is coming to the hospital, and what is this procedures going on, or what are the barriers blocking patient getting discharged. So with this summary, care providers can really know what to do, using this information to prioritize what they need to do, and eventually, hopefully, it will improve their discharge processes and reduce length of stay, and definitely also the readmissions too. So this is more at the level of supporting people on the ground, and in addition, for the people at like, for example, at the administrative level, so they wanted to know what is going on holistically. So this is where we are providing some sort of a dashboard on the populations that the hospital system supports, and to kind of identify some of the critical unique characteristics, such as, okay, if this is if this is the length of stays going up, getting increased, what is the reasons of that? So we are able to provide some of the characteristics, such as how many patients are discharged because of some of the restraint problems, so that like some of the follow-up team will need to take care of this group of patients, so that this patient is not really coming back to the hospital very quickly. How many people are discharged with the chest tube needed, actually. So you need to treat this particular problem more, whether these are the problem like increasing the length of stay. So so in short, so we leverage kind of the NLP here, kind of surfacing these unique components for hospital system to look at their the discharge plan, the length of stay problem holistically.
That's really interesting. I'd be curious to hear, after maybe 6 or 12 months, how maybe operationally some of these hospitals are able to make improvements to drive a better experience, lower their costs, lower some of these key metrics like readmissions. So yes, keep us posted on that. Yukun. I was curious, Linda, he touched on this idea of, we have kind of individual, like, analytics that help us at the individual patient care level. And then it sounds like we have these that can also support us at the population level. How is data from Ella being used to extrapolate maybe larger conclusions, or maybe care plans for more of a population, for example?
Yeah, so because of what we're collecting, so not only are we collecting the type of cognitive issue the person is having, but also some of the symptoms. And so what we might see is that we're noticing that someone who has vascular dementia, isn't it interesting that they also have diabetes and COPD? So we're actually able to try to get more granular in what's happening, because the more we know, and the more we know what part of the brain is affected, that's going to tell us perhaps why they're reacting or behaving the way that I don't like saying the word behaving. I like saying that they're reacting because they're reacting to something. And so our job as care partners is to try to understand that so we can mitigate and prevent that from even happening. So that's giving us a global idea of how to treat more and understanding the disease process, even based on the behaviors, reactions that the individual is having. And it also tailors it down, like I had mentioned, it's, understanding if someone's reaction, exit seeking, means they're trying to leave because they don't know where they're at and you're trying to figure out how to get them to stay there. Again, the more we understand what type of disease state is presenting those particular reactions, the more we can tailor our care to be more preventative than reactive. And so that's part of what analytics we're collecting as well.
And are you noticing any trends across maybe geographies or maybe social kind of determinants in terms of the populations that you're serving? Are you able to extrapolate some of that?
We are able to. So we track just about everything. So where exactly where they live, where they grew up, where they're currently residing, whether it's an assisted living or a memory unit, or just depending on where they're at, what part of the country. We do have some rule-based now. We actually just got a contract with a Native American group out of North Dakota. So we're actually really going to be able to tailor that information. We're collecting all of it. Now it's about the data play to be able to really slice and dice and see any correlations that's occurring based on where they're living, what their ethnicity is, what their culture is. And by culture, I mean more than ethnicity, their family culture, their living environment culture. All of that is really going to be able to help us get more granular in how we help someone, but not granular in an overwhelming way with all the data. But again, part of our little tagline is sometimes we just have to give people the answer. And so what Ella's trying to do is just give you the answer. Our analytics are going to look at the profile of the individual, all of that information around their social determinants of health, and then give folks the answer to be able to prevent and reduce that reaction.
Mm-hmm. And is it contributing to any changes in medication or how those patients get prescribed?
That is one of our return on investments is medication. Absolutely. All of our interventions are evidence-based. We already know these interventions to work. The issue is that we don't know when to deploy them based on, again, that particular reaction, that particular culture, that particular person. Well, we're able to do that now. And so we're going to try and utilize those non-pharmaceutical interventions first. And that is already helping us. We have in just one reaction, which was resisting showering. We did a pilot on 110 residents. We're actually able to lower psychotropic medication by 13%, which is huge. Mm-hmm. Why does that matter? Well, first of all, we know psychotropic medication really doesn't work on dementia patients necessarily. You're really just kind of sedating them a little bit. It's not really helping with any of the care. So what that does is then it fosters perhaps more medical conditions, fall risks, because they're all sedative medications. So that you're seeing more increased falls, which means they have to go to the ER because they broke a hip. So when we can lower that and utilize that non-pharmaceutical approach, we're actually able to lower the use of that medication. It's not to say that medication is not necessary. It absolutely is necessary in certain circumstances. But why don't we start with non-pharmaceutical ways, providing the caregiver the tool to understand how to approach this person before just sedating them so you don't have to manage or deal with something that you don't know how to deal with. And so that's what we're doing. We're actually lowering the need for as needed medication, PRN medication as well, which is super important because oftentimes what happens is when a caregiver, especially someone at home or someone in a smaller setting, they're kind of on an island and they don't have a lot of staff or people to actually talk to. What they do is there's a standing order to go ahead and push a PRN when you need to. We're actually seeing that being reduced as well when they're utilizing these techniques.
Mm-hmm. Oh, interesting. So it's even being used in the homes, in home care, which I know all of us here are thinking about hospital in the home and how we can extend healthcare more effectively into the home environment. And it sounds like it's working there too.
It is. I mean, Ella's a really across, and that's the beauty of it is we start at the home, you can use it at the home, and that information all translates over to whatever level of care they're in. And we do believe we're integrated with the EHRs. So we're just one segment of the pie. And we know that we are very focused on behaviors, and reactions of people that have problems thinking. And so we can plug ourselves into our APIs will connect into any EHR. And eventually we do believe that this will help all the way down from first responders, but even to hospitals. When you have someone coming in that does have a problem thinking, you're not necessarily equipped in that moment to understand, oh, it's vascular dementia, so this is what we need to do. Ella can just flat out tell you exactly what to do and what not to do.
Mm-hmm. Can it also be used for other kind of psychiatric conditions as well?
It can be. So currently we're about a 30 to 70 split. So about 70% are memory issues, types of dementia, but we're also in about 30% of, they call them behavioral units, not crazy about the name, but that is what they are. And it's for folks that have delusions and hallucinations and even some kind of personality disorders where a caregiver doesn't necessarily know how to interact. And so when we provide that specific approach on this is what you do to prevent the escalation, you will start to see people have a healthier interaction with the residents.
Fantastic. That's a really, really helpful piece of information. Thank you. And all of us, I know, or I've heard at least behavioral health units, psychiatric units are some of the most stressed that we have in our hospital system. Yeah. Absolutely.
Yeah. And that includes the autism spectrum as well.
Yeah.
Yep.
Good point. Good point. That's a growing population.
Yeah.
Yukun, talk to us a little bit about how the alerting happens. I think, a lot of people here are from, the IT informatics space, and they're wanting to understand, like, how exactly do I get my content, my information consumed by the healthcare providers in a way that is meaningful to them? You talked about these summaries so they don't have to read the full notes, but can you give us an example of how that gets executed in a way that's useful to the providers?
Absolutely. Definitely, we have tried different approaches of integrating the system all the way into their workflow. And we find that the electronic health record integration is very necessary. So definitely HR7 is awesome kind of formats here. And we basically, when there's for example, clinical deteriorations is detected by the system, for example, because of sepsis or septic shock, we'll be able to kind of alert them and then let the care team know, okay, this patient will probably require a RAC team to take care. So and also we have actually did a kind of a detour way to get there, especially in terms of how to surfacing kind of the distrust barriers to the care provider on the ground. Actually, like, we try to build our own interface and kind of persuading them to, okay, could you log out, kind of not as a log out app, but log into a separate system to, okay, this is the spreadsheet. This is probably the best spreadsheet you could use to learn all the discharge barriers live, but they just won't, get out of the other the electronic health system to get to a new system. So we learned very hard there, and finally we found a way to integrate this solution all the way into the Epic, for example, the Epic patient list. As a couple columns there that they could use. As far as I know, probably 40% of the time when they're using EMR, they are, maybe more than that, they are actually looking at their patient list and which are the columns they are going to use. Definitely the more, when there's new columns are introduced, they're probably old columns they're going to retire. Right? For example, I think just circle back to the PC summary part, because PC summary has the age of the patients, the length of stay of the patients, potentially others. They could actually remove some of these columns and actually get kind of the PC summary column in, potentially with others, such as the prediction of your length of stay. So this could potentially be in the summary too. So compare with the columns like EDD, you have a geometric length of stay prediction. So so this is kind of like Epic integrations or EMR integration is really changing kind of the AI provider into the healthcare domain. It's just without that, like it's very hard to adopt this type of technology all the way into their clinical workflow.
Mm-hmm. Yes, well, a lot of that has to do with the fact that our informaticists here on the line did such a great job getting Epic adopted and getting the physicians to just use it as their single source of truth. So I think we're all now needing to just adapt to continuing that practice. Absolutely. I want to open the panel up to questions from our audience. I usually like to make sure that we get some audience questions here today for Linda and Yukun. This is really, really interesting information. I think some of you on the line might have questions that are more specific to either your healthcare organization, maybe systems that you're using. Yukun, you're talking a lot about Epic. I'm wondering, hey, if somebody's on a non-Epic EMR, what is available to them, or how would they use this capability if they've been tasked with, build systems for us to help reduce barriers to discharge, for example, or help us do a better job determining, how we can reduce readmissions and use the data to do that. So I just want to make sure everybody on the audience knows that they can also ask their questions here today. Linda, what would you say on your side is probably one of the success stories you're most proud of in terms of how you have supported either a senior community or maybe a broader system in improving some of their outcomes here with Ella?
Yeah, I think, Arizona has been doing this type of work for, I would say, almost 30 years. That it actually started. I kind of got in the game about 20 years ago, and we were getting a lot of folks that were in communities that really didn't need that level of care, but you didn't really have the number of staff and the experts to really help manage those folks that are having these type of behaviors and reactions. And with Ella, we're actually able to expand that out. And so that's kind of what we've done is, let's look at, again, to be able to scale something like this is really difficult to do. And so being able to use this type of technology across, all formats have really been able to really just change the way that we're doing healthcare, and really being able to be personalized, person-centered, which everybody uses those buzzwords. But, when you look at person-centered care, we have to understand someone's culture, and it's a collaboration, and you have to empathize, and all that's great, but that's not that simple to do. And so, being able to provide that information to people that are caring for others is really just key. And it's really changing the way that we're doing things, because before it was paper-based, just like an EHR, but nobody really, it's really difficult to get that information fast and electronically when it comes to someone's behaviors or reactions. And so we're actually able to take that paper-based behavioral plan, treatment plan that's on a piece of paper or buried in an EHR that's, downloaded PDF-wise, and get it in the palms of someone who's actually caring for someone. Really scale this aspect of the business, of the industry.
And are you seeing that the physicians are also using it, or is this being used primarily by the like the nurse or a medical assistant, somebody that's just delivering care and looking after their patients?
So right now, well, both. And so we're actually have a contract with an Arizona-based psychiatric group, soon to be one that's nationwide, that's actually based in North Carolina. Why that's important is because they can actually, on the dashboard of Ella, they can actually see all this information. You have to think about when someone's caring for an individual that's in a placement, as an example, or even home care that's going in, you have many staff, up to 10 to 15 different staff coming in and out. It's 24-hour care, right? And so now they're able to actually assess on the Ella dashboard what's working, what's not, to give them a better indicator of what to prescribe and what not to prescribe. And perhaps even they can even help determine, the psychologist will help determine, maybe this intervention isn't working, let's try this intervention. And Ella helps provide that tool for them. And so we are seeing nurse practitioners, PAs, and doctors, MDs actually utilizing Ella to help support what they're doing in the care. I mean, as a psychologist, when I go into these communities, I try to do, first of all, you have to understand the shift change. And so shift change typically happens between 1:30 and 2 o'clock. So I try to sit there for 2 hours to try to capture first shift and second shift, So I'm getting as many perspectives as I can, because one caregiver may say, Jane's hitting me every time I shower her. And the second shift is like, well, I don't get that at all. And so as a psychologist, that's really needed information, because I would adjust the intervention. I would adjust the plan. Think about being a prescriber and you're talking to one or two and you're trying to do the best you can. And they're saying they're hitting me all the time. And the prescribers might be like, okay, well, let's just prescribe this because we want to help. We want to ease the anxiety of this resident, but also we don't want the caregiver getting hit. But unless you have the whole picture, that's what we're dealing with. And that's what we have been dealing with, is we're not getting a totality of the individual who can't speak for themselves. And Elle is able actually to provide that for all care partners. That's why we don't like saying caregivers, because it's all care partners who are embedded in helping that person with their care.
Mm-hmm. Yeah, it's kind of that like 360 view, as opposed to, I think sometimes we take photographs or snapshots in time. Right. But you're right, that doesn't give us a full picture of the, maybe things are different in the morning versus the afternoons, like the time of day can make a difference even.
Absolutely. Have many case studies on that, whether it's the diagnosis itself made the change, or the time of day, or even the gender of the caregiver. So there's a lot that goes in it, that we're actually able to ask and provide the intervention tailored to that information.
Fantastic. Thank you. And Yukun, how about on your side? I'd love to hear maybe one of your favorite success stories in terms of how you've been able to, impact some of these pop health initiatives within your customer base.
Yeah, for sure. So I think one of the I think I mentioned a little bit. One of the our unique capability is really can identify social determinant of health information and surface them all the way to case managers and even to the community-based organizations. And also to kind of connect to the referral process. I'm very grateful that PCs can help the people with the SDOH, for example, who are homeless. When they were in the hospital and they have no way to go, right? If they just deploy these patients, they will just come back to the hospital very quickly because they don't have place to live. And because of it's just part of our systems called PCs Connect here can provide kind of referral to the community-based organizations, and so that when the patients have homeless issues, for example, homeless shelter can actually reach them out and kind of and give them a place to stay. So I think this is one of the stories that PCs can help from the social determinant side.
Yes, thank you. I was reminded when you were talking about discharge barriers. I remember when I was at the hospital, anybody who's had a baby probably remembers, they don't let you leave the hospital until you've taken the class and you've talked to, they make you watch a little video about how to take care of your baby at home. And then you have to watch the car seat. There's the little car seat class, and you have to show that you have a car seat to take home the baby, or they won't let you leave the hospital. But what if you don't have a car seat? What if you couldn't afford it and you just don't have one, or you went into labor, unplanned, right, too early, and you hadn't quite gotten around to buying the car seat. There's a lot of those situations. And so, that's a small example, but it's exactly that. It's a barrier to discharge. It's a social determinant of health, right? Because we know if you don't go home in a car seat, that's, you're creating a huge giant risk for that family. Et cetera, right? So having those community resources available and that data in there to tell people hey, these community resources need to be activated for this individual, and even predicting who might have to be activated ahead of the discharge. So you're not suddenly realizing, wait, we can't discharge them because they don't have a place to go. And now you're adding 2-3 days onto the stay because you just figured this out, right? That lengthens the stay. So I think what you're saying is let's figure this out sooner, predict who's going to need those resources, engage the community partners sooner so that it's not a barrier to discharge at that moment in time.
Exactly. Well said, Rebecca. And also this is some not necessarily successful story, but this is something we are ideating to really connect the patients with the physicians or doctors there by enabling some sort of the so what we call is pieces. Pieces like patient education summary. A lot of the time the discharge summary looks very clinical. Lay persons cannot really learn specifically what the doctor is talking about. We might be able to leverage some sort of the large language model. I think right now it's very hot, like ChatGPT, etc., to kind of translate these clinical terms into some very normal term, like plain text, like anyone like in like a grade 7 can understand. So this is something we are really hoping to bridge the gap here and really help patients. And eventually, this is how we help the population.
Mm-hmm. No, I'm so glad you brought up ChatGPT. That's one of my favorite topics right now. I can't get enough of that conversation. But you're right, being able to tap into these large language models that previously were almost cost prohibitive to build ourselves. We certainly had looked into it at my company, and we were, already costing out what it would cost to build one. And so now it's like much better just to borrow theirs and layer our application on top of it, right? So I'm glad to hear that. And you bring up a really good point. Medical terminology is always a huge barrier to understanding and to being able to support adherence, which of course contributes to readmission. So if a family doesn't understand really what the orders are, what the take-home plan really is, it's going to be difficult for them to follow it. And so I love that you guys are thinking about making it more consumable, making it more understandable to anybody, whether English is their first or not first language. So that's super important to hear. And I'm glad you guys are thinking about ChatGPT as part of that capability. Like summarize this, write this in a 3rd grade reading level, right? That's a great use of ChatGPT. I love it. I'd like to go and just, we're about to wrap up here soon because I know everybody has meetings to get to at the top of the hour. I would love to hear from each of you. What are you most looking forward to in 2023? And what is the impact that you hope to achieve this year? Linda, I'd love to put you on the spot for a minute on that question.
Well, we're a startup, but we're doing really, really well. And we want to expand out across the different levels of care. Our biggest, what I'm looking to do really is we do have the first validated behavioral health database. We believe the behavioral record is just as important as the medical record. And we need to be able to integrate that into the care that everybody's providing at whatever level of care. There is an aspect there. I mean, to your point with the social determinants of health, we ask, have you ever been homeless? That might be why someone's urinating in the corner. They can't tell you why they're doing it. But if we know that information, then we can then react differently to it. Then they're just behaving badly. No, not necessarily. There's a reason why they're reacting that way. So we want to make that impact and make sure that record is just as important as the medical record. So that's our overall mission from TapRoot.
That's fantastic. Oh, wow. Yeah, I hadn't even thought about that, how all of those pieces kind of play in. And I'm glad you've brought up the homeless, the people experiencing homelessness, or maybe who have experienced homelessness as a topic, because that is something really important that has actually increased quite significantly. Yes. Here. I know here in the Phoenix area, that's been a big thing. I've had one of my customers is the Homeless ID Project, and I've been amazed at the extent to which their population that they serve has increased just in the last 2 years. So you're right, something we all need to be thinking about. Yeah. Well, congratulations, Linda. I'm so excited for what you're doing over at TapRoot Interventions, and I can't wait to see what else Ella does here for all of us. And if you're listening to this and you've been tasked with kind of figuring out how to support your caregivers who might be dealing with either patients in the psychiatric or memory care units of your organizations, it sounds like here we have a really great solution to look into.
Absolutely.
All right, Yukun, what about you? What are you most looking forward to, and what are your big plans for the year?
For sure. The two perspectives, one definitely from business perspective, pieces as a vendor hopefully could help more and more hospitals, hospital systems, and to really help them to reduce length of stay, readmission, as well as to really help to reduce their clinical burdens, especially when doctors, physician nurses are they're just so busy. A lot of time they burn out, and hopefully a PC summary could really help them. Not necessarily just to give them more information, but really help them to get things done. And hopefully we could have more of these clients, this hospital system being part of the journey. And second of all, more from technological standpoint. So we wanted to be the best kind of natural language generation provider in the clinical domain. And we are not necessarily the one like Rebecca, like what you said. We are startup. We don't have the resources to really build like ChatGPT, like a large language model. But from the applied perspective, we could probably build the best wrappers for different specific use cases, just like the patient education summary use cases. Perhaps the chatbots, right, that could really help for patients learning what is going on, not necessarily providing clinical advices. We are not doing it, but to explain what is going on. And there are many phenomenal use cases lining up. So from technological standpoint, so we wanted to support all of them.
Mm-hmm. Well, that's fantastic. I think you really said something really important there about reducing provider burnout and physician burnout. It's a massive problem. It's not just the physicians, the nurses, everybody who's working in our health system. We've asked a lot of them over the last few years. And so I think solutions like yours that are making their life a little bit easier in both of your cases, helping them feel more successful, helping them, get their help them do their jobs better, because they went into healthcare because they wanted to make a difference in people's lives, right? Not to be frustrated all day long. Exactly. And so the fact that you are kind of easing that way for them, making them feel like their contributions can make a bigger difference, I think is really important. And I think it's why so many of us are in the healthcare space. It's really about that mission-driven approach that we care about. Anyway, before we sign off here, I was trying to put the survey in the on the screen, but I don't know if I did it correctly. So I'm just going to flash up the survey link one more time here for everybody. If you haven't had a chance to take a little QR code with your phone, it should be visible for you here. We'd love to get your feedback on future topics and future speakers that you'd like us to bring in, different event ideas. This program is really for all of us here. It's our professional organization, and so it's up to us to contribute to the direction of the content, direction of the programming. So thank you very much. Thank you, Linda, for your comments today. Thank you, Yukun. I have learned a ton just getting to know both of you through this process. I've also been uplifted. I've been inspired. I'm just wowed by what you're each doing and the difference that you're making in healthcare. And I can't wait to see all the wonderful things that you accomplished this year. So thank you very much. Thank you to our HIMSS members who joined. Oh, I have something in the comments here. Oh, somebody's saying thank you to our amazing panelists. Congratulations.
Thank you for having us.
All right. Well, don't forget, while I have everybody here before we sign off, don't forget our next webinar is coming up on, here's our dates again, on February 16th. So put that on your calendar, go to the either LinkedIn or on the HIMSS Arizona chapter website. You can register for the next webinar, and that way you get the link so you can join our next speaker series. Have a wonderful day, everybody. I'll let you get back to your meetings and your busy days, as I know we all have a big to-do list today. Thank you very much. Thank you, Linda. Thank you, Yukun. Take care, everybody.
Bye.
Bye-bye.